Where is President Obama? We have a crisis, Ebola, and now there's even more chaos. And it isn't even as though this is a big surprise. The World Health Organization tipped the president off about Ebola in March and then again in August. Yet we still don't have consistent policies that all states, all cities, and all hospitals are following. Ebola is real. It's dangerous. It's contagious. What happens if it hits your hometown? Who's going to make the decisions? Is it President Obama? How about your governor? Your mayor? Well, start guessing because no one has any clue.
We believe it's appropriate to increase the current screening procedures for people coming from affected countries.
And that's a common sense approach that the federal government wasn't taking.
I think it's common sense.
A person could require mandatory 21-day quarantine.
People who are asymptomatic do not transmit.
I am the governor of the state of New York, and my number one job is to protect the people of the state of New York.
Nurse Casey Hickox has been in a tent in isolation at University Hospital in Newark since Friday, and she says she's being treated like a criminal.
The minute she was no longer symptomatic, she was released.
Somebody like Casey Hickox, who is making a commitment to volunteer her time, is service that is deserving of praise and respect. And having her sit in a tent for 2 or 3 days doesn't exactly do that.
We need to find a way when they come home that they are treated like conquering heroes and not stigmatized for the tremendous work that they have done.
I want to be safer than CDC says.
There are other steps that you can protect American people based on the scientific evidence.
I disagree with the CDC.
Go with the science.
So far, at least 9 states have issued stricter guidelines for those returning from Ebola hot zones than the CDC. Should we have inconsistent policies? Should President Obama step in? Governor Sarah Palin joins us. Good evening, Governor.
Thank you, Greta.
Governor, it seems, first of all, where do you fall on this to put people in quarantine or not who have no symptoms coming from the hot zones?
I do think that there needs to be that quarantine, but see, this is par for the course that Obama's incompetency, his administration's incompetency, is really shining bright in this one. And if only President Obama would put America first this time. We know that the most efficient and effective level of government is that which is closest to the people. Obviously, state government leadership there is more connected and much more efficient and effective than that far-off bubble, Washington, D.C., trying to call the shots for these governors. No, there is a void of leadership here, and the governors need to step up and step in.
All right, well, Governor Christie and Governor Cuomo, whether one agrees with them or not, they did step up, and I think Governor Quinn of Illinois as well has said it. If you were still governor of Alaska, what would you do?
You know, I would talk to the other governors, and I bet you we would come to the conclusion that you can't trust the Obama administration to really do much of anything right. So, yes, we would take it upon ourselves to exercise our 10th Amendment right, and that is states' rights, taking over some of these issues, especially that it's proven that the federal government isn't able to do. But also a big picture here, Greta, that I don't hear a lot of people talking about right now is we know that liberals will capitalize on any crisis. In fact, this administration, some characters within it, have advocated for and even advertised their desire to capitalize on let it go to waste. Those are some Saul Alinsky tactics, rules for radicals. One of those rules is, yes, you capitalize on crisis. It's kind of a fear mode that they don't mind the people of America being in, so that the people of America would think that they have to rely on big brother government to answer the questions for them and solve the problem.
I've heard every expert in the area of medicine on Ebola saying that you are only contagious if you are showing some symptoms. I've heard nobody suggest, although I know people are panic-stricken. I mean, who wants to be around someone who just came from that area treating Ebola patients, even with no symptoms? But in light of that, what do we do? Just, basically quarantine everyone who comes off, knowing that the experts say that they are not contagious if they don't exhibit any symptoms?
If we really want to make sure that this virus is contained, and if we cannot rely, unfortunately, on the federal government getting their stuff together and getting politics out of this issue and allowing the medical community to tell us what it is that needs to be done in each state, with each airplane landing that would have passengers in there, perhaps coming from West Africa or another nation that is suffering from Ebola, we're going to have to demand of our leadership in Washington and on the state level to get politics out of this and allow the medical community to tell us factually what needs to be done.
I don't even know if this is politics. I think it's actually more of a sleep at the wheel. And in some ways, I don't blame the governors for trying to just do something about it. Because, look, last March, the World Health Organization warned about Ebola. They did it again in August. And, you know, it does require leadership to set some sort of standard. No, this is the problem. This is what we're going to do. This is what we have. And instead, we're playing catch up this whole time and throwing everybody into chaos and people into panic. And we can't even make good decisions because everybody's so freaked out because we have no sort of sense of leadership on this.
That's exactly right. And this isn't the first time that we have encountered Ebola. Look in the last 40 years, how many times it's cropped up, along with other viruses, too. And remember, Samaritan's Purse, the doctor volunteering there, that was a long time ago, relatively speaking, Greta, where the issue was at the forefront of America's mind because you were covering it and others were covering this doctor who was going to be, you know, suffering from Ebola. You would have thought that even those weeks ago that the Obama administration would have got their stuff together and then been able to help advise, of course, American citizens what we're going to do. But remember, too, this is an issue, though, of we don't want any level of government to practice overreach. Because what, again, a liberal administration would want to do is promise the people that if you give up a little bit of your freedom, we'll give you a little bit more security, and in the meantime, you will lose both. So state level, federal level, we have to make sure that it's scientifically based, medically based, the solutions to the problem we're facing with Ebola, not allow politics to creep in and the capitalization on a crisis, because we're going to lose our freedom and security if we continue down this road.
Governor, thank you for joining us.
Thank you.
And several governors in the White House.